Welcome back to the Morning Blend. The National Institute of Health reports that about 10 to 30% of women will experience painful intercourse at some time during their lives. Our next guest is here to tell us about first-of-its-kind research that's helping women with this problem. Stacey Roberts is the owner of New You Health and Wellness. She is here to explain more about how this develops and new treatments too that may be able to address it. Good morning, Stacey.
Hey Molly, how are you?
I'm doing well. Thank you so much for joining us about this. Let's talk about it a little bit, starting with how it develops.
Sure. So typically it usually develops from hormonal changes or decreased blood flow to the pelvis for a variety of reasons, a lot of times due to hormonal changes or an injury in the pelvic area, as well to the pelvic muscles, as well as the pelvic floor. So, and then every time there's an attempt at intercourse and it hurts, then that can create more stress for the situation and cause more problems.
Yeah, I'm sure. And I wonder if some women just think, oh, it's just part of how their body is developing, or maybe it's a normal part of aging.
Yeah, that's what basically they're told, is that as we get older, the hormones change. There's not much you can do about it. You can do hormone treatment. You can try some supplements, things like that. But fortunately, there's something that's non-invasive, no surgery necessary, no drugs necessary, which is our Softwave treatment. So that's why this new research is going to be really important for these women to find something that's non-invasive that they can utilize, and it's not painful at all either.
So let's talk about this technology, because you've joined us before on the Morning Blend, and you've talked about ways that you use it on the knee, for example, because you had a knee injury, or the shoulder, or you use it with plantar fasciitis, and it's shown to be very effective. Is it the same technology that you're using to help with this problem?
Same technology, but the different aspects of the technology are what's beneficial for painful intercourse. So basically, when there's painful intercourse, there's usually lack of blood flow to the pelvic floor. So the pelvic floor needs a lot of really good blood flow, and it's kind of supportive of your whole pelvis as well as your lower back as well too. So if there's lack of blood flow there, potentially from hormonal changes that naturally happen, we want to get more blood flow to that area. So that's where this device really shines. And typically I would see patients for this problem called Dyspareunia for 8 to 12, up to 20 weeks sometimes to help them. But now with this device, what I've noticed is I'm seeing them 3 or 4 times, 5, maybe 6 times at the absolute most, but most people are finished in 3 or 4 times without pain, which is fantastic. They can go back to having intercourse with their partner. It decreases stress in their relationship, and it's fantastic for them as a couple.
Yeah, that's such good news, especially because I think it's just hard enough for them to not only be aware of it, but to talk to somebody about it, because it is a private, it's a personal issue. This technology is exciting. I wonder how many people have tried to treat it with pelvic floor physical therapy, for example. Does this replace that type of PT?
What I've seen is it's an adjunct to it. So the patients that I see have usually been to some sort of pelvic floor PT, and the symptoms have come back. So the pelvic floor PT can work for a period of time and then gradually, slowly comes back because the blood flow aspect hasn't been totally rectified. So with this treatment, it doesn't replace pelvic floor therapy, and that's really what the study is we do this treatment with pelvic floor therapy and then sham treatment with pelvic floor therapy to see how this treatment may accelerate the progress in pelvic floor therapy. So as a physical therapist, I'm always going to advocate for that because I know how well it works. But what I really love for the patients is it works better and faster when we add Softwave to it.
I want to talk about the study in just a second, but first you addressed the number of treatments that someone might need. Is it painful to have this treatment?
It should absolutely be not painful at all. Now, if somebody has a diagnosis like lichen sclerosis, which can have sores around the vulva area, potentially they might feel a little bit of stinging at the exterior part, but there should be absolutely no pain at all. And those people would be excluded from the study if they have that type of issue, because this is definitely a non-painful treatment.
We're running out of time. Tell us quickly about the study and who is eligible.
Sure. So it's the first study of its kind, a PT-led study, physical therapist-led study that's sanctioned by an internal review board. So IRB board has sanctioned it. And there's 4 different sites, my site in Milwaukee, one in Seattle, one in Los Angeles, and one in New Jersey. And we're all gathering data for patients. And people who are eligible are people who have a diagnosis of dyspareunia, which is basically painful intercourse. They're between the ages of 21 and 65, and they've not had pelvic floor therapy in the last 4 weeks. There's a few other inclusions and exclusions, but when they give us a call, we can explain that to them, and there's a consent form that they would need to sign as well too, so they're fully informed prior to starting the study.
So exciting that you're one of the sites chosen for this study, which is so important. Stacey, thank you so much for joining us to explain the problem and an exciting treatment for it too. We appreciate your time.
Thank you, Molly. Great to see you.
Great to see you too. And I want to make sure that people know, if you're interested in enrolling in the health study, please call 414-299-8121 to see if you meet the criteria to be a participant. Now, if enrolled, you're going to receive a 50% discount from a normal treatment session, and you will be seen weekly for 4 to 6 weeks. For more information, be sure to visit their website, newuhealthandwellness.com, and use that phone number to ask questions.